So, Lord Lieutenant, David, our Vice Chair, Bruce as our host, thank you. It's a great honour to be with you here. 101 years, nearly as old as my job. So, I am well known for saying things a bit off the cuff, but because this will go on YouTube, I'm going to be quite well behaved. As both the Chief Medical Officer for England, in which role I work very closely with Ruth, who's a fabulous colleague, and the Chief Medical Advisor to the UK Government. And what I picked out to talk to you today was about epidemics and how they can and will affect every one of us here, not just through illness of ourselves or our families, but actually through your businesses. And I thought we should think a bit about the role of business in limiting epidemics. And it's interesting that my role started with cholera and has gone further on. So every time we leave infection behind and think we've got on top of it, we discover we haven't. And there are real problems at the moment, as we're going to talk about. I'm going to talk a bit about what's the difference between an epidemic and a pandemic, seasonal flu, unpredictable epidemics and pandemics, and then looking ahead. And of course, I'm very happy to answer questions at the end. So, we all know we are about to hit the seasonal flu period. That is to say, flu in winter. No one's been able to tell me why flu proliferates in the winter, but it does. It's in the southern hemisphere in our summer, and it's in the northern hemisphere in our winter. And the difference between an epidemic, when you've got rather a lot of it around, and there are various case definitions, but it is rather a lot, and a pandemic is when we get a new flu virus, so different from previous viruses that as a community we don't have any resistance against it. We haven't met it before. And inconveniently, we don't have any vaccines for it. So not only are we ill-prepared as people, but we're ill-prepared as a system to deal with it. And we won't have that immunity. And pandemics can happen at any time of the year. And our last one in 2009 actually started in the summer. And that pandemic term, as many of you will remember from 2009, and I'll show you, actually refers to how broad spread it is rather than how horrible it is. So let's just think a bit about flu. We all recognise it when we see it, except for men with man flu, of course, but that's quite another issue. It's a respiratory illness. You not only get a headache, fever, cough and sore throat, but actually when you've got good going flu, you feel ghastly, aching muscles and joints. And there's a very wide spectrum of illness, minor in healthy people to hospitalisation and, of course, every year some deaths. And indeed, we've just been doing some work and found that people who are very mildly ill can pass it on. And that's one of the reasons why healthcare workers should get vaccinated. And I'm on record as saying they're selfish if they don't, unless they have a good reason not to. Occurs in the winter, as I said. And it's interesting, it's a very unstable virus that mutates a lot, but actually meets other flu viruses and they kind of pick up genes from each other. So it changes. And we have different strains each year, usually a mixture of them, and 18 months before it arrives, the WHO gets a group of experts together who have to guess what types of flu will be coming, because it takes longer than a year to grow up the vaccine in eggs. So it's quite a complex issue preparing those vaccines. So, where are we? This is the report that I get from Public Health England every week. It's from the 17th of November, which is week 47. And the Wales box is bottom left. You've got, at the moment, a low influenza rate. We're getting to epidemic levels when you've got about 100 per 100,000. But interestingly, it's affecting the young school children most, and thereafter the very young and the older ones. Not that different, really, if you look at Northern Ireland, though it's a bit worse and Scotland's a bit worse. And again, you can look and see from this data which groups are being impacted. But look at that graph, and what you can see is last year against this year, and we're all poodling along. I don't know whether I can show you it. Yes, here, on a flat line at the moment, all the 4 nations there. So we'd expect it to go up over Christmas, which is after all week 51, at some point. And when it's cold, it goes up faster. So we don't want a cold winter. I also get Flu News Europe, and this gives you what's going on around the place. And why this is particularly helpful to us is because it shows us what strains are coming out in other countries if they're ahead of us. Now, this data is good news for employers. Your people are at work, and if they say they've got flu, I think you might be wondering, what sort of flu at this point? I've never forgotten the person who had 3 grandmothers that died, and on the 3rd I said, no. Either it was the grandmother didn't die before or hasn't died now. Flu is low at the moment. So we've got other measures that we monitor, and Ruth Hussey will see very similar figures. And here what you've got in the dotted lines is last year, and the upper line is admissions to intensive care. The lower line, whoopsie, sorry about that. The lower line are deaths, and here we are with this year's. The green line is the admissions to ITU. So we've got a few sick patients at the moment coming forwards. And that just shows you that while most of us who are healthy and get it just shrug it off after a week or 2 of feeling pretty ghastly, not everyone does, and they can end up very sick. So we need to protect everyone, and we do that, as I've said, by vaccines. Here is our vaccine uptake, and what you see going out beyond that ellipse there are last year's data, 65-year-olds and under, and over, sorry, I shouldn't keep pressing the wrong thing. It's very sensitive, this. There, the at-risk people with chronic diseases there, and then here we've got pregnant women. We know from the pandemic and other data that pregnant women getting flu can lose babies and become very sick and die. So we really want that uptake good. And in fact, this year, across the UK, if you can see here, we're doing better than previous years. Though we're doing much the same with the risk groups here with chronic diseases and the elderly. The elderly we do fine, and the WHO always says how well we're doing. But the risk people, we're not doing well enough. People with asthma, chronic obstructive airways disease, renal failure, hepatitis, motor neurone disease, diabetes, neurological complaints. We really need to protect them more. So we need to work with people who are ill, and GPs call them up and try and persuade them to come. We need to work with long-stay residential care homes and, as I said before, healthcare workers. I cannot understand why they don't come for vaccination. I've had mine, I hasten to add. We're focusing this year on the people who are most at risk. I've mentioned those, the pregnant ones and those with problems. But I do want again to highlight that this won't protect against a novel pandemic that could appear. So let's just look at that last pandemic that came. You'll remember it started in Mexico, came from pigs, so as the Mexicans not unreasonably got upset that we were talking about Mexican flu and everything, it became called swine flu. These numbers, the H's and the N's, just tell the experts exactly what sort of bug it is, what sort of flu virus. And to start with, from Mexico, it looked as if most people were dying. So we had a pandemic, we had no immunity. In Mexico, a lot of people dying, and we were very worried about it. And it was not covered by those strains of flu in the vaccine. It played out that actually it wasn't as serious for most people. So when we eventually got the much fuller data from Mexico, we discovered that what they'd told us about at the beginning was the tip of the iceberg, the serious cases, but there was a lot more infection out there in the community that mattered. But we saw deaths in pregnant women and in others. And in August 2010, it must have been 29 actually, August 29, we had a pandemic called by the World Health Organization. Now, just look how serious this was. Look at the big pandemics here, 69, 70. The peaks of flu here, even 89, 90, a big peak, and this is our pandemic. So, a lot of people think that everyone overreacted, and that actually we've now lulled people into thinking this isn't important. And if I give you one message today, it is that it is better to act speedily when we see a pandemic coming and then find that it's not a severe one and row back than it is to say, oh, actually pandemics don't matter, and then find it's infecting this sort of number of people with those associated deaths. I actually think we did well in that pandemic, and the impact on business and the economy was low. So I'm going to come back to impact of pandemics and flu and things on the economy and your businesses. But let me just mention a couple of other infections. I want to talk first about SARS, which happened between November 2002 and July 2003. It started coming from poultry in southern China, caused an eventual 8,096 cases with a 10% death rate, 774, in many countries, though the majority were in Hong Kong, and many of you will remember the panic and the problems in Toronto and Canada. Within weeks, it had spread from Hong Kong to 37 countries in early 2003. And it had a massive impact on both Hong Kong, China, and Toronto and Canada. I was in Toronto, in Vancouver actually, at the beginning of September, and they were still talking about the impact of SARS on business. So obviously, you don't get any tourists, and we'll come back to tourists and Ebola in a minute. But people stay away from stores and restaurants in areas where cases have been reported, trips are cancelled and postponed, industries offering services to people, restaurants, hotels, airlines, cinemas hit very hard, and all their suppliers. And Toronto still talks about the impact on their business. So clearly, it's in all your business interests that we get our public health right. And that's a shared responsibility. You can't offload it on Ruth and me. As women, we've got broad shoulders, but we can't do it all for you. Now, the bottom right picture is of a camel, and it's there to remind me to tell you about another infection that threatens all of us that you may not even have heard of. The Middle East Respiratory Syndrome coronavirus. So it's a relative of a cough-cold virus, and we know it as MERS-CoV. And we think the reservoir is in camels because we found antibodies and virus in them. The first case we had was a very sick Qatari who was flown in by private ambulance for intensive care, was treated with everything we could manage, and eventually died of multiple organ failure months later, poor man. And this was reported in 2012. Now, in Saudi Arabia, as of the middle of June, they've already had 700 cases of MERS, including 287 deaths, so about one in three, no more than that, really, are dying of this. Last month, there were a handful of cases in Turkey. This is all around the Middle East. I can tell you I'm not taking my children on camel rides any longer, interestingly, and we used to go on them if we were in that part of the world. The risk to most travellers is low, but we're getting imported cases with people from these areas. And the WHO doesn't advise travel restrictions, but interestingly, the Saudi Arabian Ministry of Health has advised for the Hajj and their other important pilgrimages that elderly people, pregnant women, children, those with chronic diseases should postpone their pilgrimage. So, in discussion with experts, they have advised people who are particularly at risk not to go on the Hajj. And that is serious. That impacts on their culture, and it will impact on their income. I don't know that that's serious, but it's a point to bear in mind. So actually, just look what the World Bank has come out with. We've got a line on the low and middle income countries, but I want you to look 2 lines beneath at the Europe and Central Asia line. Whoops, I've done it again. The World Bank speculated about the possibility of pandemic flu and based this illustration on SARS in Hong Kong. Hong Kong experienced a peak decline of 75% in air travel during the SARS epidemic and an average decline of 50 to 60% during the 4-month period the outbreak was active. Retails declined by 15% at peak and by about 9% over that 4-month period, implying a 15% decline from trend over the 4-month period, or about 5% on an annualised basis. If we dropped our GDP by 5%, we would feel it, all of us, not just those businesses that were specifically hit. And in this table, in this, whoops, can I find it, 3rd column, what you can see are the largest impacts. This is about individuals changing their behaviour in the face of the pandemic, reducing air travel to avoid infection in the enclosed airspace of a plane, avoiding travel to infected destinations, reducing consumption of services. I've talked about restaurants, tourism, mass transport, non-essential retail travelling. So in the scenario I've put up here, it was assumed that for the year as a whole, air travel would decline by 20%. Tourism, restaurant meals, mass transportation, also by 20%. So very big issue. And actually what the SARS also showed was it impacted well beyond the national boundaries. A lot of the luxury goods sales in Paris and London and places like that went down as well. So it can hit us, even if it's happening on the other side of the world. Your businesses can be impacted. What about this one, which is happening at the moment, which is having a massive impact, not only on those countries, but as we will discuss, on the rest of the world. So Ebola is a little virus. It's an RNA virus. It's actually rather a fragile virus. It's very easy to kill by washing hands or any disinfectant. If it's not in the body, it dries and dies off very quickly. It's important that I highlight that it is only spread through bodily fluids, that it is not spread as flu by aerosols or anything. So it's very difficult to catch. And it's very, very unlikely, like it won't mutate into one that does transmit through the air. But it is transmitted through bodily fluids. So what happens is people catch it from bodily fluids. I'll come back to that. They're then well while they incubate it, 2 to 21 days, and they're not infectious. And then they begin to get symptoms, and they are, through their blood, semen, saliva, infectious. But it's only in the latter stages of the disease when actually they have, sorry about this, vomiting, diarrhea, and profuse bleeding from the eyes and skin and everywhere. when it's easy to catch, unless you wear that extraordinary personal protective equipment that you have seen on the televisions, double rubber gloves, masks that cover the whole face. So it's difficult to catch until then. And it actually started with one child who probably ate bushmeat up there, where that arrow is. And we know, it's never been in West Africa before, we know that bats carry it. We know it's in some monkeys, and they don't seem to get sick from it. But if you're rolling back the forest, the jungle, they may come closer to you. If you're hungry, you may eat bushmeat, and actually some people think it's a delicacy. So people catch it from bushmeat, and then it's transmitted round. And it's transmitted by those bodily fluids towards the end of the disease. And even now, we know all of this. We knew it before it happened in West Africa, but first of all, people didn't realise it was happening and took a long time. And then when they did and started to try and do something about it, they worried about isolating the infected people and didn't think about the anthropology and the culture of burial. And in Western Africa, they actually handle the bodies with respect, washing and everything. And even now, a good 50% of the infections, if not more, come from corpses and the handling after death and through the burial system, even though we've all been working very hard with everyone, and the government and everyone recognises it. Now, to date, we've had about more than 16,000 cases in these 3 countries and about 7,000 deaths. And on the left-hand panel, where it's red, we've had more cases, and where it's white, we've had far fewer cases. Well, in fact, some of those rural areas, we've had no cases. The way we're trying to cope with this is under the coordination of the World Health Organization. The USA is leading in Liberia. The French focus on Guinea, and we are leading the response in Sierra Leone. And I have to say that I am very proud of what this government is doing. Our NHS, yours in Wales, ours in England and Scotland, has more volunteers to go out there than the rest of Europe put together. Their backfilling in the NHS is paid for from our DFID, our International Development Ministry's funds, so that the NHS has inconvenience but is not financially lost out. We've got 800 pairs of boots on the ground, and seeing the MOD go in, plan a hospital, work with the contractors and deliver it is, for someone like me working in the health service, amazing. The efficiency, the speed and the way it's done is just fantastic. So there's a lot of work going on, but we are not winning. If you look at this, these are very similar plots, cumulative rises of patients. One is a patient database, the other a SITREP, but they are essentially the same. And you can see what the case rise is doing. And at the moment, in Sierra Leone, it's going up like that. And for every person infected, another 1.7 people are infected. So for every 10 people infected, 17, they'll infect another 17 on average. Except we do have the data on 2 funerals, which infected between them 50 people. So it's a bit variable. If we want to get on top of this as a world, and I assure you we do, then we have to bend that curve so each person who's infected infects less than 1, bending the curve down. To do that, we have to isolate people who are infected, and we have to change the culture around the handling of dead bodies and the funerals, and it's very difficult. So, it is absolutely ruining the economies of those 3 countries. There are no direct flights. You have to fly out via other bits of West Africa. Cases spread to Nigeria, which has contained it and is Ebola-free, to Mali, where we're waiting another few days to hear it's Ebola-free. And if it does move into one of those other big countries, which has a big diaspora with the UK, and becomes out of control, this could be very serious for our health system and even our economy as well. So the World Bank on Wednesday released some new figures citing the possible costs of the disease on the wider West African region. So in their low Ebola scenario, where kind of we'll get from 16,000 to 20,000, so actually this won't happen, it's sure to be worse, and we get on top of it, the lost GDP for West Africa as a whole is estimated at $2.2 billion in 2014 and $1.6 billion in 2015. For a high Ebola estimate, it'll be $7.4 billion and $25.2 billion. Both cases assume some spread to other hospitals. Now, I think it's going to end up somewhere between them. But already, the Gambia is losing its tourist trade. Already, on East Africa, people are backing out of tourist trips that they were going to do. Yet they're safe. They don't have Ebola. I was terrifically impressed when Mandela's widow stood up and berated Africa and said, why is it we expect Britain and America to sort this out for us, and we watch the impact on the African continent? We don't help our brothers, and we don't sort it for humanity, and we don't sort it so our own finances are all right. The majority of these costs stem from the higher costs of doing business within countries or across borders. One of my friends has a son who lives in Wales and runs a mining company in Sierra Leone. His business is seriously impacted. They've been pulling out the Welsh miners who supervise, and what will happen to that mine? It's very, very worrying. Transportation is disrupted and there's restriction on travel for everyone. I should just tell you that I do expect us to get up to a handful of cases over the next few months, but our public health systems, run by Ruth Hussey here and by Public Health England in England, will cope with it, and I don't see it spreading. So, after that sad story, let me just look ahead, because we can't predict the next epidemic. But there are clearly things we can do. Good hygiene is important to prevent infection and for fighting influenza in particular. So people need to wash their hands, and those alcohol hand washers that many businesses and all hospitals and healthcare places have are very good. People need to be taught, because we've somehow lost some of this, that if you have a cough or cold, you should sneeze into a paper tissue, bin it so it's killed. There's this wonderful concept of respiratory hygiene that we had lost and we need to find again. And our working environment, everywhere when there are lots of coughs, colds, flus, we need to make sure that the bins are emptied and that the people who empty them use disposable gloves. But how about all of you? When those economists have looked at the costs and benefits, they found vaccination and these hygiene measures make sense economically, because just think what having 10 to 20% of your workers off at any one time will do to your business. So you could run a flu awareness campaign, particularly where people are handling food, and you can help protect people against other infections. You need to remind people what flu is, what it isn't. Make sure if they have got flu, they actually go home. Think about home working. Are they able to log on at home so they don't infect others? And if your workers are in risk groups, they've got chronic disease, make sure that they have the time to go and get their free vaccinations. And if your workers aren't in a risk group Have you thought about whether you should pay for a flu immunisation campaign in your own work, in your business? It actually does make sense. The American CDC have done some work on that and shown that. So what I've been trying to do as I go through is talk to you about infections that we have around us that we need to protect ourselves, our families, friends, colleagues from. But actually, I believe you need to do things now proactively to protect your businesses from and to help us be much more effective in our campaigns. You may have seen that we have started a campaign to vaccinate 2, 3 and 4-year-olds, not only to protect those children from flu, but actually because just all of you know 3 and 4-year-olds, you may have had them, but they spread snot everywhere. Respiratory hygiene and a 3-year-old? No, I don't think so. And they crawl over people when they're miserable, demanding to be hugged. They're called super spreaders. So persuade your older workforce to make sure they get their grandchildren vaccinated with the free vaccine, because then you'll help your workforce. It is a question of health education, but I hope I've shown you enough evidence that you can see it's a question of good business and good economics as well. Thank you very much.